Today, on December 17th, the first round of COVID vaccines were administered to frontline workers at Palisades Medical Center. HUD Post was on scene at the request of Hackensack Meridian to witness history. Healthcare workers were the first to receive the vaccines. Here are their stories.
So the process was amazing, and the cooperation of our entire team here at the hospital has been amazing.
Well, I think that the vaccine is going to help us to really combat the virus, and I really want to put out a message to my colleagues to do the same. And I think that this is really going to help us to protect our patients and our community and our family and our friends, of course. I think that everybody should get vaccinated as soon as possible.
I think everybody is a little bit hopeful and a little bit joyful, especially now at Christmas time, that this has happened and that this is here. It could potentially be the beginning of the end of the pandemic, and everyone is very much looking forward to that, having life go back to the way it was before.
They is afraid about the vaccine because, it's many misinformation in the media, in the social media. But I think this is safe. Yeah? This is science.
I had also been asked by patients whether they should get the vaccine or not. And what I told them was that as soon as I could possibly get it, and I didn't think it would be this soon, I would get vaccinated. There is some hesitation amongst the community and even some team members, and I wanted to show them that given the science that we have and the evidence that we have and the studies that we have, and given the fact that this COVID epidemic is not going away, this is a second wave here in New Jersey and New York, in the metropolitan area, and the rest of the country is having a horrible first wave pretty much, that unless we do something to prevent the bug from infecting people, this is not going to just go away. We've become much better at treating the disease, but there is no real absolute cure. The best thing we can do, as in many things in medicine, is to prevent the disease. You mask, you socially distance, and the better you do that, the more likely it is you're going to be safe. But now we have something else as a preventative, a very strong preventative, that at least in these studies show to be 95% effective, and that is getting vaccinated. So if you want the epidemic to go away, if you want your lives to return to some form of normalcy, if you want your health and the economy to rebound and return to where it should be in the next few months, we need to get as many people vaccinated and protected so the bug will basically disappear and have no place to infect.